So they gave me a pink outfit because they watched it. Now I have penguin feet. And yeah, they colored my piercing and my ears and my head.
I got LASIK surgery done, also known as PRK surgery done. Yeah, it's kind of different than LASIK. And yes, I can see you guys. Finally! Hi people, welcome to my channel is Trishni. Yeah, I know I'm like coming 20 years. 30 years? Yeah, I suck at consistency. Good night. This blanket is too short. Yeah, I know the lighting kind of sucks, and this is like a very homely setup. I decorated this room when I was 16, but I got my laser surgery. You can see, but I have to wear glasses because I'm still in my healing period. You know, like my power was like minus 5.5 in the right, and I've had spectacles since nursery. And you know, the type of work I do, I have to be like on screen, and I prefer not wearing my glasses all the time, right? So I just never wear my glasses, and yeah, my power just gets. And yeah, since kindergarten, I've been changing so many spectacles. I don't know, like changed so many spectacles in my life. It's insane. What is the procedure I did? So there is one called LASIK, where they just use laser, but the PRK is a type of other surgery where like because of like cornea's issue, or maybe because it's a high power like my case, first like take out literally like one layer of your eye, the first epithelial layer of the eye. They take it out and then they put the laser focus on the eyes. Yeah, that's how the procedure is done. So that this is like a longer healing period. Yeah, don't talk about my ear. So I went there to the hospital and we had all those, you know, routine checkups done, like, you know, normally. Like eye test on eye test, eye test on eye test. The whole morning I was just doing eye test. And then they took me to the ward.
This my piercing because I don't know, it'll reflect the laser beams or something. I don't know, just this over. Like I've been sitting. I'm in the hospital since like it's been more than 7 hours, and now there'll be like operation or like whatever this is, like surgery or you want to call it a procedure. Okay, that'll be for 10 minutes, and then I have to sit for another hour because it's post-operation care.
They didn't tell us that it's gonna be so okay, and I was just waiting. After like a lot of mess, after a lot of time has passed, at around 6 p.m. they took me for the surgery. And I was there, bro. I kid you not. You have to see it, right? Like, think if something out of your, like, you can see something, one is scraping something out of your eye. Like, bro, that's insane. I had to see that. Like, I had to keep my eyes focused on a specific circle, and there was like a red circle. And I had to keep looking at it. Otherwise, you know, laser will just go anywhere. And yeah, and bro, like, they were literally scraping it out. I was like having so much anxiety. I was having so much fear. Like, what if like, and you know, actually, the doctor on the right, another doctor performed, and on the left, a more experienced doctor. The first one, she was actually struggling to remove it, and that actually got trauma because later on, when the doctor was doing my left eye, it just took him like 1 minute, while that other lady was taking like around 4-5 minutes. And yeah, he told her that on spot that, you know, you're supposed to take it out at one go or you're gonna cause trauma. So, you know, later on during the healing period, before 72 hours, I had to go for the emergency again because I was having allergic reaction on the right eye. So yeah, that was one thing that happened. I went through a lot. I couldn't see shit. I couldn't record shit. I was just like sleeping the whole time. I was so done. You know, during the healing process, it feels like a glass is literally like stuck on your eyes and it's like, you know, poking you, and it's so painful. And you know, whenever I would see light, I would just be like photophobia, and kind of I still have photophobia. Like, yeah, like I shouldn't put so much strain, and I have to keep taking eye drops every day. So yeah, this is what's happening right now. I'm just taking a lot of eye drops. I'm avoiding eye makeup, as you can see, like going the clean girl aesthetic when final messy girl aesthetic is back, and I'm like doing clean girl face. Yeah, kept my eyes shut the whole time. I was just sleeping. I was just like, why? Let me just sleep it all out. Now I'm back, and would I recommend the surgery to anyone? I mean, it's just like you're gonna experience it once in a life. Like I was literally looking at the red dot and imagining it was blood moon because I had to imagine something pretty out of that shit. Other than what you see, like, you know, of course they like put anesthesia, you like there's a numbing. I dropped a bit before the surgery, so you don't really feel that during the process. But the fact that you can like see it like that, like, you know what I'm trying to say, like, I don't know, it was just very scary to me. Like I was having so much ID, I was like literally feeling and puking while that was going on. Like this was a good decision though, because though like initial healing and all, it'll be painful, but whatever. And if you have like anxiety problems but it's fine, like it's just once in a lifetime, so I have to get power again. It'll be like back when I'm like 40 or something. Anyways, I'm good now, and I just remembered I have to take more eye drops. I'm like taking like 4-5 eye drops 4 times a day, and then I'm also taking like this one eye drop like 6 times a day still. So they are mainly for like bacterial infection or like allergic reasons. They're used for like a lot of other diseases too.
There are like 2 more patients here, and they said it's gonna be like a 10-minute procedure.
Okay, so I can see sometimes blurry, sometimes not blurry. I don't know, my vision keeps changing. But like it'll fully like be like a fixed vision in 6 months. So yeah, I'll be like tripping though.